Good morning. We are live on the Casually Baked YouTube channel with Dr. Kirsten Shepard. She is the founder and CEO of Pain Stoppers. Kirsten, thank you so much for joining us on the podcast.
Thank you so much for having me. This is an honor.
Yes, I'm really excited today. First of all, when I saw the name of your company, I'm like, hello, great name. We all have issues with pain. And then to find out that you're actually based in Austin, Texas, which is my home. I live in Oakland now, but I still have my 512 digits.
That's so cool.
Yeah, so I wanted to talk to you today about, this idea that you're bringing to life of what I'm calling hybrid healthcare, combining all of these different modalities along with the plant medicine, these cannabinoid protocols and being able to help people all over the country. You don't have to live in a legal state where cannabis is readily available. There are options out there for a more, all-encompassing type of healthcare that's available to people even in prohibition states. So let's dive in first and talk about this idea that you had about combining these different modalities into your practice.
Well, I love the term, Joe, that you used as far as hybrid healthcare. And I might have to steal that from you, but I think that, you know, that's what we need, the direction that we need to take healthcare in. Unfortunately, in the United States, I feel like we have a health system, and the fact that they even call it a healthcare system to me is just, it doesn't make any sense.
Ridiculous.
It's
Yeah.
ridiculous. It really is, because we're the lowest. We're less than 5% of the world's population, yet we consume over 95% of the world's pharmaceuticals. And we're not, you would think, considering we're the richest nation, one of the richest nations, we spend the most per capita. $2.3 trillion was what we spent, I know, in 2019 on healthcare. Then you would think that we would be the wellest people in the world, and we're not. Our citizens are becoming more and more sick, but yet we're using more and more pharmaceuticals. There's something that's not meshing with our system, and it needs to be changed. To give you a little bit of my background, I am a chiropractor and a massage therapist. One of the things that I learned early on is that medicating chronic pain makes no sense at all. And if you look at where our country is right now, even though we're in this worldwide global pandemic, the opioid crisis is still happening. People are still dying. And that is something that could have been prevented, but yet, we're still not openly accepting cannabis as medicine, as a treatment option. We're seeing different laws come about throughout, legislation, and, communities coming together and advocating for cannabis, but it should be available to every individual that wants to try it, just because it's non-toxic. So why is our thinking different from what it should be? The motivation is clear. I mean, we live in a capitalistic society. So you and I, as well as your listeners, I'm sure, can look at the dollars. And one of the things that I always say is our healthcare system, it doesn't make sense, but it makes a lot of dollars. And who's on that
Hell yeah.
receiving end of those dollars?
Absolutely. I mean, that's one of the biggest things everywhere right now. There are systems falling all over the world. And if you follow the money, shit gets interesting.
It really does. It really does. I remember at one point when I was in high school, and this is before I even knew what I wanted to, really focus on in college. But I remember when the pharmaceutical companies started advertising on TV, because they weren't allowed to before. They could only go direct to the providers' offices with their reps. But, it's interesting because looking at our television commercials, in the United States, we have three main things you're going to see on TV: pharmaceutical sales, you're going to see fast food, and you're going to see a lot of alcohol commercials. Those are guaranteed. Watch TV for 30 minutes on any major network and count the number of times you see those types of commercials. Now, at the inverse, if you go to Europe and you watch TV, the type of commercials you're going to see there are extremely different. They're going to be lifestyle commercials, travel, fashion, and you're not going to see these pharmaceutical companies, blasting all these different solutions to whatever it is. And that shows you how much are they spending per day. And I haven't researched that, but that's something I want to look at. It has to be, in the hundreds of millions per day, if not more than that, on advertising. And so they're just trying to reach us with options for drugs, for alcohol, and, food that makes us sick.
Yes, that perpetuates their industry. And, the pharmaceutical industry is the largest funder of the FDA. And yeah, it's all a sick joke. And I talk about this a lot that, we have to watch these alcohol commercials, and there's really not, aside from maybe having a little red wine every day, there's not a lot of benefits, or any for that matter, of consuming alcohol. Yet whole plant medicines and, mushrooms and different functional quote unquote drugs, they have to be hidden. People have to risk their, life, or being a parent or something, to get these natural remedies for things like pain and inflammation and all this shit, versus taking the pills that end up, putting them in their grave. So it is really ridiculous. And so I like how you have, taken the information, when we know better, we do better. And you've taken everything that you've learned, and you've, tried to create this holistic experience for your patients. So talk to me a little bit about that. What is your practice like?
So our practice is fully integrated. And when I say integrated, of course, as I stated before, I'm a chiropractor, massage therapist. So of course that's added into the disciplines and the treatment options that we have. I have a medical doctor that works with us. We have an acupuncturist. We have a few other massage therapists and a physical therapy assistant. So one of the things that I wanted to do was to treat the whole person. Most of the time when individuals go and see their primary care provider, because of the lack of time they have, because of the type of practice they may have, most practices now are these huge groups, but we compartmentalize the care. So if someone comes to see me because of back pain, for instance, we're not just looking at their back pain. We're looking at them as a whole. Your back hurts, you probably have knee pain, the ankle might be affected, the neck might have, something going on with it, but we're able to take the time and spend with them and find out what's your diet like, what type of activities do you have. And in the traditional world of allopathic medicine, where they're lucky to be able to spend 15 minutes with their patients because they're trying to get those numbers up, you can't address but one thing at a time. And so I wanted to offer the same type of whole person healthcare that the athletes and celebrities receive to everyone. And I think that's what everyone deserves, especially our seniors and our veterans, because they pay the most debt to society, yet they're the ones that suffer the most and end up getting bypassed or overlooked because there's just not enough time.
Yes, I agree. And I had a veteran on the show yesterday, and we're talking about what his life was like as a soldier, the things that he was put through in the name of, freedom and protecting our country. All this stuff is so ridiculous. There's wars that happen that there's no reason for it. And we train young boys and now young girls to go out and be on the front lines of this, but then they come home and they're not getting the proper treatment that they need to re-enter into society and live a life that isn't debilitating. I mean, he's younger than I am, and he's 100% disabled and he's got traumatic brain injury, and now he's crafting cannabis and working, trying to get the laws changed for the VA. And they've just been approved for a medical study for PTSD. And to me, like, that's the tip of the iceberg. So much
Absolutely.
more needs to be done. And I appreciate veterans like him that come back and, try to rattle cages to get it done. But you're exactly right. When we see these celebrities on television or these professional athletes, and we're like, wow, like they look amazing, they're not aging. And it's like, yeah, they have a personal chef. They have special medications that the rest of us don't have access to. There's something that my sister's been sharing with me called these med beds that, it's technology that's existed for a really long time, and it's able to, we are vibrational beings living in a vibrational universe. And so it's a lot more than just the dense muscles and bones and blood flowing through our veins. Like, there's energy work that can be done. Acupuncture is huge in helping us move the flow of energy through our body. Yet you go to a regular doctor who has been educated in these schools that have been funded by the assholes that are trying to, perpetuate the nonsense. And they'll tell you that chiropractic care and acupuncture is all hocus pocus bullshit.
Mhm.
And it's not true.
And it's unfortunate, and there's so much research behind it. I mean, how can acupuncture, something that's been around for thousands of years, and before we had pharmaceuticals, there were the shaman and the medicine men and women who were doing exactly what you said, using plants as medicine, and the medicine ended up being, the plants ended up being synthesized so that we could have these medicines. Now, I'm not saying in any way that all medicine and medical doctors are bad. We need them. I
Of
think there's a
course.
place for them. But if we're looking at certain conditions like neuromuscular skeletal conditions, that's nerve, the muscle, we're looking at the bone with like arthritis conditions, or even when we look at cognitive function, PTSD, these pharmaceuticals, when you watch these commercials, you listen to all these, 20 seconds or 25 seconds, out of a 30-second commercial is going to tell you all the wonders. And if you're suffering with this, then you should take this because this is going to help you and it's going to resolve it. But then in that last 5 seconds, they're going through over 100 side effects. Some include anal leakage, that you may experience for taking this, or you may need to take, for instance, with the opioids, do you have opioid induced constipation? We'll take this pill to help you with that. And that is not a solution to anything. When you're looking at functional medicine, which is what we do, you're looking at the root. What is the root cause of this? And it's not just let's throw a prescription at this condition and, come back and see me in 3 months and let me know how you're doing. That's not how we need to focus on healthcare. We need to change and really make it healthcare and get out of this sick care model, because what I'm seeing and what I feel is everything's leading to kidney failure, pancreas issues, liver toxicity. And then what do you have? You have dialysis centers on almost every corner, just like you see a McDonald's and a Krispy Kreme. Something's wrong with that.
Yeah.
Especially
Yes.
with all the money we're spending in this nation on healthcare.
Well,
We
and I
have the
love that you
most,
called it sick care.
it's sick care, but we have the most hospitals and the most doctors per capita than any other place in the world. Shouldn't we be the healthiest? There's
This is
something
true.
wrong with it.
And yeah. And, it's not only that. So we've got the healthcare piece like that. And then again, 5% of the world's population, 25% of the world's prisoners. Like, there is big business in keeping the citizens of this country down, and we have to start shifting the way we think about these things and stop giving our power away to other people, and like be very thoughtful in how we choose doctors, choose, methods of consumption of whatever, medicines that we're going to be taking. There's so many ways that we can take our health and well-being into our own hands, but it's been so easy to hand it over to somebody in a white coat or hand it over to a politician, which, they need to just lock up DC and torch the place and start over.
Start
Like,
over.
it's
I agree
insane.
with you. It is. It's really sad. But I think that one of the great technological advancements that we have is the internet, because now people, patients are more informed. They know that there's options. And one of the studies that I recently saw talked about the percentage of people that have been utilizing cannabis for the seniors that have been utilizing cannabis for their pain management or, whatever condition that they have. And they're not even speaking to their primary care providers about it because they don't feel like their doctors have enough knowledge about
Yeah.
cannabis, which is really sad because it can be used in conjunction, with other therapies, and we can really help people get well without having the toxic effects that a lot of these pharmaceuticals have. And I think it's a disservice that it's not part of the educational process and programs, especially when we see the success and when individuals can get their life back and start living the quality of life they deserve, especially, and I'm most passionate with our vets and our seniors, but especially those that have done so much to allow us to live the way they paid their dues. They allowed us to live the way that we live, and their quality of life while they're retired, should be the best available, period. And they shouldn't be suffering with chronic pain or any other conditions that they don't have to. And especially when there's true options that can help them that don't cause any other conditions or any other detriment to their health. It makes no sense. It's senseless.
Well, and there's an organization called Green Flower, and they are rolling out cannabis education programs at universities and colleges across the country. And, that's a really important thing for us to do as citizens and as, fans of hemp and cannabis and whole plant medicine, is to reach out to our educational institutions and tell them that it's important that we have, cannabis education and programs for people to learn about it. Like, there should not be another, pre-med student that doesn't learn for an entire semester or year about the endocannabinoid system.
Right. Especially when, it's just as important as our nervous system, which is the master system of our body is the brain and the spinal cord that controls everything. And the ECS is what regulates everything. So why would you not teach anyone who's in healthcare? Why would you not teach them about, the ECS? It's a disservice, but I think things are slowly starting to change. So I'm very optimistic. I've seen quite a few universities now offer cannabis master's programs. And I think that slowly they are adopting, but it's like we're always playing catch up. And we should be ahead of this game. And hopefully, the future generations will definitely be able to have access to not only cannabis products, but high quality cannabis products, because that's another problem when you see convenience stores, and everyone's carrying CBD, because it's legal in all 50 states, but not all CBD is created equal. So one of the things that we like to do is try and educate, individuals about how to block out some of the noise that's in the industry, because if you don't know, you can definitely be risking your livelihood, as you stated earlier. Law enforcement, agents, educators, if you have a career in which you may get drug tested, then you need to stay, gear more towards 0% THC products so that you're not risking your livelihood, even for some athletes, and I don't think everyone takes that into consideration when they're looking for resources to help them with pain.
Yeah, and I think one of the other issues too is that it's a buyer beware market in, hemp and in cannabis. And I would say, even less in cannabis, because now we have dispensaries. There's, these legal states have protocols for this sort of thing. But in the hemp industry, where it's sort of the Wild West still, you have to be an educated consumer to make sure that you are getting the right product and not being a victim of some, bait and switch. And, the multi-level marketing companies where, yes, they have great technology and, and they're using all these big words to describe what their CBD is, and they have beautiful packaging. And it looks like, wow, this must be the best CBD ever. And somebody's spending $150, $160 for a 30-day supply of this. Well, that's not practical and it's not necessary. I mean, you're paying commissions to people up the MLM ladder. And so, I'm like, MLM CBD companies, like, go away. They're not, it's ridiculous. And so it's just like trying to figure out, okay, who is a reputable source, and how can I easily access the certificate of analysis? Like, there are certain things that really good CBD companies and health professionals are doing to make that easy, to be super transparent. And and the fact that you have a medical doctor on your staff, you're treating these people, and then you've added on this CBD protocol where you can talk them through what that might look like for them. And, I'm pleased that you're in Texas, and, there's so much, work to be done in that state to get whole plant medicine approved. But I do think people are doing a good job. I just think there's too much people wishing, like, well, I wish it was legal here. And as my dad would say, wish in one hand, shit in the other, and see which one fills up the fastest. Like, you have to do something. You have to talk about it. You have to ask questions. You have to rattle cages. So talk to me a little bit about what it's like for you being in Texas, having a practice where you are integrating CBD in a really big way into these people's, health protocols.
So in our practice, we always sold some sort of topical, and what was interesting, and I think I should probably go back to how I kind of got into CBD myself, was my father suffered from mesothelioma, which is the asbestos cancer. And during his chemo and radiation, he had no appetite, was in a lot of pain, and was nauseous. I knew about medical cannabis, and I just wasn't really sure how to go about, really starting anyone on a protocol and dosaging or anything like that. And so, of course, you don't really think about things until you're faced with trying to find a solution to something. And I had a few friends that were in California and Colorado, and I was like, send me some samples, see, can you just send me something? My dad was open to trying some of the tinctures, and he didn't like the taste of the tinctures. And some of the tinctures that, I didn't know that had been sent to me actually had, higher quantities of THC. So he also didn't like the feeling of being high. And I remember him telling me, this was cool back when I was young. He's like, but I'm too old to feel like this, and I don't want to feel like this. And so that's when I discovered that CBD was, one of the main components that was actually responsible for, some of the effects that I was looking at, and that you didn't have to have, you could have either 0% THC or low THC. And so we started switching those, and he did better, but he didn't like the taste of the oils. And that's kind of how I created my own topical, because knowing that the skin is the largest organ, why don't I rub it on and let's see what happens? And it gave him relief. It increased his quality of life for the short time that he was still with us. But one of the things that he said is, you helped me with this. You should do this for others. And that started me kind of beta testing, different formulations. We currently have a global patent that's pending on what I call our extreme formulation. With that one, I would like to perform some clinical trials and get FDA approval. But I knew I was onto something when I had retired professional athletes calling me and saying, hey, I need some of that extreme. I need some more of that. That really helped. And some of the individuals that were testing my products, and it varied. I had some that had knee replacements, because their joints had been all blown out. And after surgery, it helped
Hey,
so much
Dr.
with the
K,
swelling and the pain.
you
Yes.
you cut out a little bit, and I don't want to miss that whenever I'm recording the actual podcast. So the professional athletes, they were these retired athletes were reaching out to you. Repeat that part for me, if you wouldn't mind.
So these retired professional athletes were reaching out to me and saying they needed some more of that extreme, whatever that is, that works. And, it not only helped with their pain, some of them, that had gone through surgeries were saying their swelling was going down, and it really helped them more than some of the pharmaceuticals, of course, that, they were prescribed post-surgery. And I even had a couple of individuals that had gone through some elective procedures, and they're like, I felt like a bus hit me, but then I put some of that on, and I just knew I was on to something. And so I kept researching. I finally developed the first product in our line was the Pain Stopper Salve and our Extreme. And, I grew the line and did a full launch in November of 2018. And another interesting thing that happened during the launch was I had an 89-year-old patient who was there, and I was explaining to them, this is CBD, so it doesn't have, the THC that's going to get you high. So it's low THC, or some of our products have none, and it's not going to give you that psychoactive, effect that'll make you feel high. Well, they actually booed me, and I was speechless and shocked, or boo. And I was like, wait, this is this little old, this senior church lady who's so
That would be
sweet.
me.
And I was
I'm
like,
old.
wait, did she just boo me? I'm like, okay, but those are some of the things that we have to work with, advocacy and our legislators to, be able to have more of an open playing field. What I noticed in with what we do in our office. So in addition to doing therapies, we also have always done what I call advanced therapies, which is including stem cells with regenerative medicine. And, for some of our patients, we were able to use our products to help them get off of opioids. And there's, plenty of research that's out now that talks about utilizing cannabis, to help combat the opioid crisis. And I'm looking forward to seeing, more outcomes on that. But we just did studies in our office, and eventually I started having other practitioners, reach out to me. So I also have a consulting side of our business where we do train other providers on integrating what your hybrid medicine
Hybrid healthcare, yeah.
aspect, yes, to what we do, because the functional, the regenerative, the recovery portion of what we do with all of the therapies is beneficial, but being able to have an extra tool in your toolbox, and especially when patients are looking for, natural products to give them relief anyway, I think it's best for providers to be able to guide them through, because as you and I know, everyone's body responds differently to everything. It's not a one size fits all. And I think finding, the sweet point for an individual when it comes to dosing, the cannabis, whether you're using THC products or CBD only products or a combination, what your body's going to respond to versus what mine will is completely different. And, as healthcare providers, especially in the recovery world and rehabilitation, we see our patients more frequently than traditional providers do. So I think that we're geared and positioned best, to be able to tweak things and help guide them through the process.
So when you were talking earlier about the couple of products that you started out with, those were both topical products. Now, consuming the cannabinoids internally is got a higher bioavailability. So what do you have in that regard?
So right now, our line has two different types of oils. I have one that's filtered and decarboxylated, and then I have one, that's the most natural form, the purest part of the plant. And so I call that one our green and our red line. And so with, depending on, number one, what's the goal? The things that we take into consideration is, overall, what goal are we trying to achieve? Why is the patient, wanting to take it? How will this benefit them? We also look at what type of career they have, because that needs to be considered, because we don't want to affect anyone's livelihood, by trying to help them.
Because
And
that's
then,
because the green has trace elements of the
yes,
THC
it's the
cannabinoid
point in
and red
Texas, we
doesn't.
have the point, the red doesn't. And so we'll
Okay.
know what to start them off on. But I prefer, to start individuals off on our green oil because, of course, it's the most natural, purest part of the plant. And so it's going to stimulate the most receptors in the endocannabinoid system.
Yeah, that
So
full
we do
spectrum,
have,
if you can take full spectrum, it's always best. But then if you can't,
absolutely.
isolating the CBD is the next best thing.
And I like combining, the topicals with the oils if they're open to taking the tinctures. And that's simply because, they can get the synergistic effect of, the outside in. The topicals are usually faster acting, but they're also getting the healing from the inside out. And so, for individuals that are open to trying the oils, and some individuals just don't like the taste of the oils, even if you flavor it, you put it in honey or what have you, they just don't want to take the oils. So we're able to have a little something for everyone. And soon we'll be expanding our line to include some other options, but we're still doing some research and development on those to kind of make sure, I want to make sure that everything is not only effective, but like you said, that it has what it's supposed to have in it. So our certificate of analysis, and I'm very particular about anything that I recommend because our patients become our family. And if I wouldn't, give it to my 17-year-old, daughter, then, it's not something that we're going to use. And that's always been, our philosophy in our practice and with any of the docs that we work with as well.
Absolutely. That's the way to go. So tell me what some of the symptoms are that people come in to see you for.
We see chronic
You cut
pain
out
in
again.
we do a lot of
You're cutting out again, Dr. K. Can you repeat that again?
Joe, are you there? It went black. Can you hear me?
I can now. If you'll start over with the types of patients you see, that'd be great. And is
Yes.
your is your
So
device plugged in?
the
Is your device
number
plugged into
one
an outlet?
reason, okay, you can.
Is your device plugged into an outlet? by chance? Like, are you plugged in? Are you grounded? Is your device grounded?
It is.
Because your mic has been a
I
little
do have
crackly,
it. I do
and
have it plugged
is your Wi-Fi? How's your Wi-Fi right now?
in. My device.
All right, so I'm going to entertain you for a second while Dr. K gets back with us. It's so hard with this distance and not being able to have people in the studio and, trying to make this work. C's 180, I can jump in if needed. That'd be great. But yeah, I mean, trying to do a show and keep this all together with freaking technical difficulties is such a pain. But anyway, I love what Dr. K is doing. One of the things that she told me once before is motion is lotion. And so, that is definitely one of the things that they are. Not only do they promote like the wellness pieces of things, but also and the CBD, but also making sure you're putting the right food in your body and exercising and keeping yourself together. All right, lady, I've been entertaining folks while you were gone. Are you back with me now?
I don't know what happened. That was so odd. It just completely shut down and but now we're back, which is great. I love,
Yes.
it's so interesting being in the virtual world now because anything and everything seems to happen whenever it feels like it. So this is so odd. But you were asking about the types of patients that usually come and see us. The number one, of course, is going to be chronic pain patients, whether it's neck, back, joint, muscle, or nerve pain. We see a lot of arthritis cases, disc herniations, arthritis, whether it's in the spine or the knee or a joint, and of course, any type of injury. So if someone's been in a motor vehicle incident, they'll come and see us. We do also treat athletes, and so we have performance recovery protocols. We're in Austin, and we have a satellite clinic in Killeen, but we typically see a lot of students and a lot of veterans. And so the anxiety protocols, and we recently started really working with some cognitive function. And with some of the protocols, we've been seeing some great advancements with individuals that have had Alzheimer's or dementia issues. It's definitely helping with those sundowners where they kind of get that confusion
Yes.
as the sun starts to set.
Yeah, because
And
CBD.
it's been really interesting to see how combining, all of what we do and being able to add.
Oh, there must be a really big delay because I said
Oh
something
no, not
like
again.
20 seconds ago. But no,
Okay.
CBD is such a wonderful neuroprotectant, and it is important for anyone who is aging to add CBD to your diet. People my age, have your parents taking some sort of CBD. It's so important. What about depression? Do you have people that come to see you for, mood type problems? Oh gosh, there's a big delay.
Not extensively. We primarily, like I said, we get a lot of students with the anxiety, but if the anxiety and depression kind of go hand in hand, you're still having a delay.
Yeah, but you're good. No, you're
Uh-oh.
fine.
Joe, you there?
Yes.
No.
Oh,
Okay. Are you able to hear me clearly now? Okay. So with the anxiety and depression, I feel like they go hand in hand. Uh, You know what? Let me try, and maybe I should shut everything down and just try and join again. I don't know why our signal's so poor today, but let me try that and see if that'll help. Now I see you fine, but I don't know how long that's going to last.
Well, if
Let's
you
try
want to do
again.
that, yep, I'll do another dog and pony show over here on the live stream. I'll tell people. So I'm very excited to report that I will have a new micro series starting soon on Casually Baked, the podcast YouTube channel. We are going to have a new segment called Roll With Me. So I am a terrible joint roller, and I, being a microdoser, I normally don't have any reason to roll a joint. And during COVID, there's not been anyone that you can actually share a joint with. So I was reached out to by the folks at OCB, and they want to support what I'm doing. So I'm going to be having my friends from the cannabis industry join me on the show, and they'll give me tips on rolling joints, and we'll talk about cannabis culture and what's happening around the world. So stay tuned for that coming up real soon. And Dr. K is back with us. Here she is. Right. Let's try again.
Hopefully the third time is the charm, Joe. Let's see.
All right.
No. All right.
Man.
Okay. I see you. Can you
Okay.
hear me?
I can totally hear you.
Uh,
Yes, you're good. So let's talk.
all right. Hope.
Oh, fuck me, man. This is exhausting. Um, okay. I want to talk, I want to shift gears, but I'm afraid I'm going to say this, and let's talk about your experience in the industry. Can we talk about, you deciding, so CBD was something, it was helping you help your dad, and you started coming up with stuff and you decided to get into this industry. What has that journey been like in the hemp and cannabis industry for you as a woman and as a Black woman?
Well, in this industry, we are few and far between. Less than 4% of cannabis entrepreneurs are people of color, which is a shame when you look at, we're the highest percentage to be incarcerated because of cannabis offenses, and many of our community is still incarcerated for cannabis offenses, when we have another portion of society that continues to make profits off of this industry. There's a huge disparity in what we're seeing in the industry. And women, make up maybe about 20% is what I read as far as entrepreneurs in cannabis. And across the board, women and minorities are often overlooked when it comes to funding. And that's even looking at traditional resources like the SBA loans, for instance. Cannabis entrepreneurs don't qualify for any of those. But even when we're looking at just traditional options, for funding for a non-cannabis entity, Black, brown, people and women are historically underfunded. So we have, opportunities like all these venture capitalist groups, but depending on what you look like, they're not readily available and open to giving us a chance. And so the majority of, the entrepreneurs that you see have bootstrapped, or they've raised funds, and stretched as much as they can. And we need to be given those same types of opportunities. It makes no sense. And if you look at, women in business, research shows that companies that have women, at least one woman, on the board, but they are more successful than companies that don't. So what's the problem? Why is there such a disconnect? And we need to change that. It doesn't make any sense at all.
Yeah, I find it interesting that anytime in the history of mankind that women have wanted rights, we've had to ask a man for them. It's like,
Mhm.
what the fuck?
Absolutely.
And I
And
I have experienced that in my own entrepreneurial journey of, I'm bootstrapping things myself because I wasn't willing to do, or enter into the type of world that was going to get me looked at to get funding from someone else. I mean, I would feel like I needed a shower after leaving some of these, VC funded networking events where I'm like, wow, there were a lot of people interested in me, but I don't know if they listened to shit about my business. And, I just feel like so many women aren't taken seriously in that regard. And so, my goal is to build my business to the point where I can personally fund other women's businesses.
absolutely, and that's one of the goals that we have as well. As we make it, we definitely have to reach back and help others. Especially in a climate to where it's not being done openly. And I think that more venture capitalist groups and more investors need to seriously consider, the role that women play and the role that people of color play in their businesses. One of the other things you were talking about, leaving and feeling dirty. I've had experiences to where I know that one particular investor, that I'm thinking of, offered a colleague of mine who was a white male, an investment with wanting a certain amount of equity. But when they came to me, and my company has outperformed theirs, several times over, they wanted more equity in my company for the same amount of money. And so, we definitely know that these conversations need to be had, but real change should be um, it should be instrumented across the board. It needs to happen across the board because, we're in 2021 now. There's no reason why, men who are still making decisions for everyone that don't know anything about the decisions they're making should have those types of leadership roles and should be in control. We can look at, what's been happening, just with women's rights when it comes to health care. How can you as a man tell me what to do with my body as a woman? There's a problem with that. And I think, when it comes to funding, when it comes to leadership opportunities, I think that, we definitely have to advocate for ourselves. And, we've got to throw out smoke signals and do everything to say, hey, we're over here. But if you look a certain way, you don't have to jump through those hoops, and it's not fair.
Yeah, and I think the other thing too is just being really honest and open about what our experience is. There's so much shame that women carry around with them in their DNA. And when we have these bad experiences, or, we feel like we're being taken advantage of, or we know that we are not being offered the same plate that someone else is who is, equal or lesser in qualifications than we are, you have to talk about it. You have to do what we're doing right now. Start the conversation. Let other people know that this is happening, because I know not all men are bad. Some of my very favorite people in the whole wide world are men. But, until they understand the situation and the struggle of being a female entrepreneur or a person of color in, wearing an entrepreneurial hat, then, nothing's going to change. And there's so many, like we started out in the beginning of this conversation, there are so many broken systems right now that have to fall so that we can build something with a foundation that works for everyone.
Absolutely. And, the equality factor, we've made some strides, but it has not been enough. And I'm optimistic that things will change and open up more, and the opportunities will be there. Because if we look now, we for the first time in history of this country, we have a female vice president. And so now that gives hope to the future generations that you too, can have those opportunities. So I'm optimistic, even though things are moving quite slow.
Well, I'm always a glass half full kind of a gal myself. I want to, when I'm home in Austin, I want to come see you in person and us record a podcast where we don't have any of the snafus and we can have a nice flowing dialogue. And I'd like to see your practice and us, do some events together and really promote this lifestyle, the cannabis for wellness and hemp lifestyle, to people in the Lone Star State. And I'm excited that you're expanding into other states. Is there anything that I didn't ask you or that we didn't touch on that you think is important to kind of round out our chat before we jump off?
No, I think that we've discussed a lot. I just want to encourage, I'm sure most of your listeners, if not all of them, are already cannabis advocates, but please get involved with your local organizations in your state and help push legislation, especially for states like Texas, where it's still new, and we're still figuring things out. There's a lot of House bills that have recently been introduced, and we just need to do more to advocate for cannabis so that it's an option for mainstream Americans every day, whether it's for a medical condition or for your recreational use. You should be allowed to use this plant as medicine. Alcoholism and alcohol kills more people and is more harmful on your body than this plant is. It makes no sense that is readily available anywhere that you want for you to consume, where something that can help in so many ways improve your quality of life isn't.
Amen. Again, follow the money, people. All right. Well, thank you so much for your time. And thanks for sticking with us on this live stream through all of our, it was kind of a circus, but I haven't even smoked weed today and I'm feeling pretty chill about it. So, so we're all good.
That's a good thing. That's a great thing. You must have some stored in that in those adipose tissues, so it's releasing slowly. That's one of the beautiful things. It's not going to waste it. It's going to store it and release it as you need it too. So it's been such a joy. I thank you again for having me on your podcast, and I look forward to when you do come visit, Austin again, and getting together and being able to record something live. This will be wonderful, and keep doing what you're doing, because we need more individuals sharing their voices and exposing others to the wonderful world of cannabis.
Thank you so much, Dr. K. And thank you to the Casually Baked Tribe for hanging out. And we're